Well, if you have a special guy in your life, ask him if he's had a PSA test recently. This simple test could save his life. Dr. Mark Scholz is a board-certified oncologist. He's also the executive director of the Prostate Cancer Research Institute, and he joins us now to fill us in on what men actually know about this test. Good morning.
Good morning. Thanks for having me on.
Nice to have you this morning, doctor. Is the PSA test itself harmful or painful?
Not at all. I mean, no more than any other blood test. It's just like a blood sugar test or a cholesterol test. So the PSA test is not the problem. The problem is that it leads to a lot of other testing in some circumstances, and unfortunately, it can lead to unnecessary treatment that can cause harm. So it's not the test that's the problem. It's what we do with the information that could be problematic.
Now, tell me about this United States Preventative Services Task Force. Are they recommending against the PSA?
They are indeed, and this is a rather shocking thing, considering that the PSA test is considered routine, a routine part of the physical examination that's done every year when you go in to get your other testing done. Now that this recommendation has come out, many people are unaware of the fact that some of the family doctors have dropped the PSA test from their routine testing. And not only are they dropping it, they're not talking about it. So when men go in for an annual physical now, they're going to have to ask for the PSA test, because sometimes it's just not going to be done on a routine basis anymore.
My grandfather, my dad, and 2 uncles both found out they had prostate cancer through the PSA test, and I think all of them would say that they're alive because of it.
Right. There's no doubt at all that PSA has reduced cancer mortality. And the idea of simply dropping it out is we're throwing the baby out with the bathwater here. This is really serious stuff. What people don't realize is that there is a potential for overtreatment of low-grade cancers, and that's what the task force was concerned about. They're not total numbskulls. I mean, they did look at the pros and cons of this issue. And so, but the solution isn't to stop PSA testing. The solution is to use the PSA information wisely and not overtreat the low-grade types of prostate cancer that could be safely monitored.
Let's talk then about what men specifically should ask their doctors about the PSA test.
Mm-hmm. Well, as I said before, we first need to ask if we're going to do it. And I think that will lead naturally into a discussion about the pros and cons of the test. The real concern is if it just isn't done and it isn't discussed. But once the topic comes up, the doctors can then talk about these things, about how it saves lives in some men and how it leads to overtreatment in some other men. And then the men can themselves make a decision. At least they can have the information to make a sensible choice.
If a man has a history of prostate cancer in the family, are your recommendations or suggestions different?
Well, we recommend, of course, that PSA screening start at about age 50 for normal guys. But in a situation where there's a family history of prostate cancer, we recommend starting about age 40, at a younger age, to start annual testing at that point. And the final point is that men need to be aware of the fact that this test previously was routine, but now it's up to you. You're going to have to ask for it.
Where's a good place for people to go for more information?
We have a website. The Prostate Cancer Research Institute has at pcri.org, Prostate Cancer Research Institute. They have information about screening, about all kinds of treatment. So visit the site and you get more information there.
Thank you for your time this morning, doctor.
Thanks for having me on.